Hey everybody, it's Dr. Abraham with Kryptonite over here, uh, Bianca, and we're doing live at 5, and happy Halloween.
Happy
to everybody.
Halloween!
Kind of dressed up today, so everybody in the office is dressed up, which was kind of fun. We got to have some fun during the day, and now we're just going to do the live at 5. We are talking about PRP because it's Halloween, and we figured blood would be a good topic to talk about. We even have a blood puddle over here. I don't know if you guys can see it, but that looks pretty realistic when it's on the ground. But,
All right.
anyways, yeah, so ask us anything, specifically if you have questions about PRP. We already have some questions over here, so we're going to be talking about it as we go.
Yeah. So one of the number one questions that continues to pop up all the time is the vampire facial, and especially since it's Halloween, we have a lot of patients asking, what is this? I'm curious, and they talk about like a vampire facial, vampire facelift. What is
Sure.
that? Can you explain that?
Yeah, the vampire facial and facelift are actually there are procedures that it's a specific name that's given to a certain procedure that does involve PRP, and it just the name itself just kind of caught on just because it's a pretty cool name, and the vampire word has to do with the fact that we're using the patient's own blood. Usually, with the vampire facial and facelift, we're doing a combination of the treatment involves a combination of PRP, where the patient's blood is drawn and then it's used along with microneedling or with injections on the face, and sometimes it's combined with the filler, where the facelift portion comes in, because like when we do fillers, for example, in the cheek or in certain areas, that can also help lift the face. It's usually referring to something that has to do with PRP and or filler, depending on each client, and microneedling.
Do you one PRP treatment, is it enough for patients to get the results that they're seeking?
It's enough to see some results. Is it enough to see? It's gonna depend what the patient's starting with and how much results they're gonna see. So most clients, even with one treatment of PRP, they're gonna see results, and especially if we're talking about PRP face treatments or even PRP joint injections. Most people with the joint injections, one treatment is enough. If you're talking about hair restoration, we often need more than one treatment. One treatment is enough to see results, but it might not be the full results that the client needs. They might need 2 or 3 treatments for the optimal results.
For the optimal results. Okay. Is it normal for patients to break out after receiving PRP microneedling?
It can happen. It's one of these like side effects that happen, and maybe not in everybody. Most people aren't gonna break out after PRP. In fact, a lot of people who do tend to break out and have a lot of acne, once they do a treatment like microneedling and PRP, it kind of overall does help with their acne. But initially, just because of all the needles and all the poking, certain people who are sensitive, it's possible for them to get a little bit of a breakout. So if it does happen, it's normal, but for most people, it's not going to happen. And I know we've talked about that before, but just, for people who are kind of like listening for the first time, or they haven't heard about PRP in a while, the whole idea behind the PRP microneedling treatment is to rejuvenate the face. That's something that we should probably mention. It's a very popular cosmetic or aesthetic rejuvenation treatment, where PRP is applied to the face along with microneedling to help freshen up the face, to help with the texture, with collagen. As we all know, as we age, we start losing collagen in our face, our skin texture starts to change, we lose elastin, the elasticity of our skin goes down, we start seeing these fine lines and wrinkles. And so PRP is one treatment to help combat all of that and just rejuvenate the face in general.
All right. What about treating dark under eye circles? Does it help with under eye circles?
So we do a lot of clients love to focus for under the eyes for PRP, and it does help. There are a couple things that can go with the under eyes, and we always try to be very transparent and very realistic with our clients and what it can and can't do. Many times if their skin changes, meaning skin discoloration, actual like brown spots or circles around the eyes. The PRP isn't necessarily going to change, these brown spots. That being said, it can be a very useful treatment under the eyes because it's going to help rejuvenate the skin. When people say dark circle, they mean a lot of things. They can mean like different things, but often when we have that hollowness under the eyes, it creates a shadow, which is what people call the dark circles. So they're not really referring to necessarily like actual dark circles in the skin. It's usually just the shadowing from the hollowness that's under the eyes, and that's something that we can address with PRP, or even better, a combination of PRP and filler, just to fill that area, increase the skin, and that can definitely improve the look from the the under the eyes look, whether it's kind of improving that look that people, because when that happens under the eyes, people always complain that they look tired. Sometimes people don't even come in pointing at the under eyes. They're like, I don't know what it is, doc, but like I look like I'm more tired than usual. I feel like my face is droopy, and when we fix the under eye portion, they just feel more awake. They feel better, and we often do that with PRP and or fillers.
So I know we're talking about just microneedling, and you're talking about fillers for under the eye, but what about doing injections in the face with the PRP? Can you use that instead of fillers, or do you get the same results?
Yeah, very good question. It is a question that people always ask. We can, especially we take a very concentrated form of PRP and we do inject it under the face sometimes. And it is something that if you can do, I would recommend doing when you're doing the microneedling, because now you're getting to the deeper layers of the skin that you can't get with the micro. So the microneedling is gonna get you like to the top layers of the skin, but with the injections we can get even deeper, and we can direct the PRP and kind of affect multiple layers at that point. So when you do injections, it's usually gonna be a more powerful, more potent treatment. The downtime might be a little bit longer just because you're doing more injection. You might get a little bit more bruising. But with both treatments, we're only talking about a couple days of redness, maybe 3-4 days of redness, maybe bruising for a little bit longer than that. But the bruising can usually be covered up. It's not gonna be huge, amounts of bruising, but little bruises here and there. So if you can, take the downtime, usually I would recommend doing the injections in addition to the microneedling, and that will kind of give you the best of both worlds.
Okay. Does PRP microneedling help with rosacea?
Indirectly, it might not be the kind of first line treatment for rosacea. And in fact, it kind of has to do with acne. Sometimes people with rosacea, once they do the initial PRP, they might get an actual flare-up with rosacea just because of all the mechanical trauma to the skin. So in the short term, I would say no, but we've had clients who in the long term it does help them just by kind of improving the skin quality and skin texture. It indirectly helps with rosacea. So I wouldn't say it's it's a first line treatment for rosacea. And in fact, initially it might flare up a little bit, but in the long run, we've definitely had clients who are very happy that it did kind of calm it down.
Calmed it down. That's good. What about for acne and acne scars? Like, I know we asked about if you break out after microneedling, but if a patient has an acne breakout, does the microneedling help? And then does it help with scarring from like teenage years kind of thing?
Yeah, and it's very good to differentiate between acne and acne scars because they're very different, but a lot of times people, they'll call for acne, but they really mean acne scars and vice versa. And it's very good for us to know because that will help determine which treatment is better. A lot of time with actual active acne, we might recommend like a peel first or some kind of facial to help calm down the acne, and then doing the PRP. As I was saying, for active acne, we've seen, especially when combined with chemical peel and other stuff, great results with PRP in the long run. Initially, it might actually flare it up in some people, but in the long run, it's gonna improve it. But for acne scars, this is where PRP can be like an excellent treatment too. It's great for acne scars. A lot of people, they have acne and they've had these scars for years, and they've been living with them, and they're not really having active acne anymore. But one way to really address it that's safe, effective, and going to be very helpful for most people is going to be the PRP microneedling with or without injections, as we mentioned.
All right. So we're getting some questions regarding filler. Now I know we've talked about the vampire facial, but switching gears a little bit, we have someone asking about jawline filler. Is there a specific brand or thickness? What would you really recommend for?
Sure. So yes, that's a very good question, because even if that person isn't aware of exactly what to use, at least he does have the right idea, which is kind of just being aware that there is some difference between fillers, and it's not like one filler fits all. And when we're doing jawlines, we're trying to define something. So we want to use a filler that's a little bit more on the firm side. That's gonna, when we put it here, it's gonna be firm and it's gonna lift. It's gonna give you a little bit of a lift to kind of help with the definition of the jawline and the jowl, and that's gonna give you that definition. So I really like to use Radias in there because it has a very high G prime. So it's really good at, again, giving you that definition and giving you that lifting. You can also use other fillers like Restylane Lift. You can use Juvederm Voluma. I would say these are the three that we often use in the jawline because they can give you definition: Voluma, Lift, and Radias. So yeah, but regardless, you do want to use something that's very firm and that's going to give you a lot of lifting.
Okay, so you said G prime. What is that? And can you explain that?
Yeah.
To
So, a lot of times people will hear us talking and they'll hear that we're throwing that, we're saying these names of all the different fillers: Juvederm Volbala, Juvederm Valor, Restylane Lift, Restylane Refine, Define, Kiss, Classic, Radias, Bolatero, and they're like, what's all that? Most of these fillers, not all of them, but most of them are made of hyaluronic acid. So they all have very similar composition, but the way they're structured is a little bit different. They have, even though it's the same kind of active ingredient, they all have slightly different properties. And one of the main properties we look at when it comes to filler is the G prime. And in a way, it kind of points to the firmness or to the thickness of or how strong that filler would hold. So something with a low G prime might be more appropriate for an area like under the eyes where the skin is very thin, or for the lips where you want something soft that's gonna mix very well with your tissue in a very soft way. But if you were to put something that's very soft in the jawline, it's not gonna give you that definition because it's very soft, so it's just gonna blend in a little bit more than you want it to blend in, and it's not gonna keep that form, it's not gonna keep that shape.
Okay.
So when you want something that's you're trying to shape a jawline, you're trying to shape the cheeks, you want to do something that has a big higher G prime that's going to give you better definition.
Okay. Someone is also asking for the lips, how many syringes would you use? And then can you explain about, when we say a syringe, how much product is actually in a syringe? Because I know when we say that, people tend to get, well, I'm getting a whole syringe, so can I do like everything? So if you can explain that.
Yeah, a syringe is honestly not tons of volume. It's usually 1 ml, 1 cc. And that is really, not tons of volume. Now we use it in the best ways we can to get the most volume out of it. Mm-hmm. But it's, 5 cc's is 1 teaspoon, and the tablespoon is 15 cc's. So you can, you're talking about 1/5 of a teaspoon with each ml. So it's really not tons of volume. And that's why we're talking about jawline, you can use, multiple syringes in the jawline, and you want to, if you want to see like a difference, because it's such a big area. If you put 1 or 2, 1 or 2 cc's, which is less than 1/2 of a teaspoon, you're not going to see, between 2 jawlines, you're not going to see a huge difference. Now with the lips, usually we do one syringe is a good place to start for most people. Depending on how much volume you want, some people might need 2 or 3 syringes. But with the lips specifically, we like to do 1 at a time anyway. So when someone comes in to do lips, usually we just do 1 syringe, we have them wait a few weeks, and a lot of people are just happy with 1 syringe and they stop there. Some people want a little bit more, so maybe they'll come back like a few weeks later, a month later, and then they'll do another syringe. So generally speaking, we're talking about 1 syringe and the lips, maybe 2, but even if we're doing 2 or 3, we're not doing it at the same time, we're doing it one at a time.
Okay, that's generally why we try to get 2-week follow-ups, right? To have the patients come back in to see how things are going and, you know.
Yeah, and initially there's some swelling, some bruising. Sometimes we say, you know, like when you do filler, you don't want to love it, you don't want to hate it for at least 2 weeks because it's going to change a little bit in the next 2 weeks. And that's something that a lot of times people will see like on Instagram pictures where it looks amazing right after, but sometimes that's, you know, the way the lips look right after isn't necessarily how it's going to look in a couple of weeks once some of that swelling goes down and stuff. So it is just something to keep in mind that, yeah.
Awesome. Cheeks and chins, is there differences in fillers for that as well, and what would you recommend?
They would be more similar to the jawline
Okay.
than they would be for the lips, for example, because again, with the jawline you're trying to define, that usually extends into the chin, you know, you're not using some, it's not like firm here and then all of a sudden it's really soft, it's all along the same line. Same thing with cheeks, you know, like just the way here, you know, you feel your bone here, you know, you have that definition, you have the cheekbones, so it's going to be very similar to the jawline. Now, we do tend to separate the cheeks into different components, so like the middle of the cheeks, which is the apple of the cheeks, sometimes we do use something softer because it's not on bone, as opposed to like using doing the cheekbone itself, or cheekbone, so the word bone is in there. So yeah, so generally speaking, cheekbones, you want something more similar to jawline. In the mid cheek, the apple of the cheek, you can use something a little bit softer sometimes. And you do usually need more than 1 syringe in the cheek because it's a much larger area as opposed to the lips, for example.
Okay. Let's see. So, talking, I guess someone's asking about Botox. Units. How many units could you normally do, like in the forehead? What is recommended for forehead units for Botox or Xeomin?
Botox and Xeomin are gonna have very similar recommendation in terms of how many units. Usually when we do the forehead, we're using, generally speaking, 4 units because 20 of these units are gonna go in the forehead. But we're also gonna, when we do the forehead, we're usually doing the glabella with it, which is the 11 line. And so the 11 line usually takes 20 units in most people if you want the full dose. The forehead, the standard dose is 20 units, which is why we get the 40 units between the 2 areas. Sometimes people, especially if they're starting earlier, they might do a little bit less, especially in the forehead. So you don't have to exactly stick to the 20 and 20 recommendation. Some people have very strong muscles and they need a little bit more. But for most people, if you really wanted to see like, you know, good results and you want it to last the 3 to 4 months, then you'd want to do 20 units and 20 units.
Okay, awesome. So it looks like we have our last question. We're going to jump back to some PRP. Someone's asking about regrowing hair, or if you're bald.
Sure.
Can the PRP help with that? And then how many sessions would a patient have to have in order to see results?
So yeah, with PRP, it's great for people who are losing hair. Now, we always tell our clients, because we don't want to give them like false hope, or we want to be, you know, honest with them. Someone who's like bald, who really lost all his hair, the PRP is probably not going to be that beneficial to them. It's not going to grow new hair, you know, where there's no hair left. But where it's very popular and where we see a lot of people, you know, coming in to do it, is for people who are, you know, actively losing hair and they want to slow down that process. They want to reverse some of that process by thickening and strengthening the hair that's, you know, that's still there, and they want to slow down the process. And you know, with hair loss, for most people, it's a process that's going to happen over years. You know, you're not going to have a full head of hair and then wake up the next day and for no reason just, you know, have lost all of your hair. It's something that you're going to notice happening over a year. And if you are going to lose, you know, your hair at 30, but now you can do PRP and, you know, you can extend that till you're like 40 or 50 or 60, then this is where, you know, PRP can be a very useful treatment. So it's great for people who are, you know, they see that their hair is thinning, so they still have the hair, but it's a lot thinner. It's when they're showering, they're noticing that a lot of hair is falling down more than usual. So it's not too late. So we do PRP, and it can be very useful there. But if you have a completely bald spot, if you don't have the hair follicles gone, the skin's closed over it, you're not gonna create a new hair follicle, unfortunately, with PRP.
Okay.
Yeah, I think that was a good session today. Maybe we went a little bit longer than usual, but thank you guys for joining us. Happy Halloween, everybody. Happy trick-or-treating. Hope everybody has a great weekend. Spending it with their families and their loved ones, and we'll see you guys next time.
See you next time.